To the UK now, Prime Minister Rishi Sunak is in Northern Ireland. He's hosting US President Biden in Belfast. It's a very short visit, not even a full day. Northern Ireland is a conflicted region. It saw 30 years of violence. Then a peace accord was signed some 25 years ago. It's called the Good Friday Agreement. Biden has come to mark the anniversary of this agreement and to hail its quote-unquote tremendous progress. But Northern Ireland remains conflicted. Brexit is unraveling the delicate peace. And Rishi Sunak has his plate full. When he comes back to London, he'll have to deal with another crisis. The rising cost of living is pushing people to the edge. They say costs are high and wages are low. Doctors say they're among the worst hit. And now they've gone on a strike. It's expected to cause unprecedented disruption. Here's a report.
350,000. That's how many appointments and operations are expected to get postponed in the UK. That's over 250,000 patients having their treatment put off to a later date. And this is happening because junior doctors across Britain are on strike. It began on Tuesday and will go on till Saturday. Tens of thousands of doctors are on strike. Just to give you an idea of how significant this is, junior doctors make up about half the medical workforce in the UK. They're not coming to work. Their demand is pretty simple. They want a 35% pay hike.
26% less. No!
It's quite a lot to ask for, but these doctors argue that they have suffered a 26% pay cut over the past 15 years. The British government has called their demand unrealistic. It says such a pay hike would mean some junior doctors getting more than £20,000 in additional pay. And Britain can't afford that.
So we are ready to have discussions with them, but clearly a demand for 35%, over £20,000 for some junior doctors is not fair or reasonable, and that is why we've not been able to make progress so far. But we want to engage constructively.
That was the British Health Secretary. Remember, the strike coincides with the Easter school holidays, Ramzan, and the Jewish festival of Passover. Also, this is the biggest industrial strike in the history of the British National Health Service. According to the Health Secretary, the strike poses a considerable risk to patient safety. But that's not where he stopped. He went on to accuse the doctors of maintaining a militant stance in negotiations. The doctors obviously have a different take on the matter. According to the British Medical Association, junior doctors earn just over £14 an hour, but the pressure on them is only increasing. Patient waiting lists and the workload is at record highs. Couple that with the cost of living crisis and double-digit inflation, and doctors are failing to make ends meet. Many of them are victims of depression and mental distress.
I mean, I'm only 4 years post-graduation, but there's already been suicides from my graduating class. I've got friends who've left medicine because it's broken them. I had to have counselling for PTSD symptoms after the COVID pandemic because it was a horror, and we're still expected to carry on as though nothing's happened, and deteriorating conditions, and it's getting to the point where we're all at breaking point, not just financially but mentally and physically. We just can't go on like this.
Our doctors are leaving to Australia, Canada, New Zealand, other industries where they feel they can provide better care and they can have their salary doubled. We're not asking for that. All we're asking for is to get back to net neutral, just back to 2008 levels where the service ran more efficiently, when the waiting list was a third of what it was today, and when doctors were being paid a slightly more appropriate wage.
Strikes in the UK have now become a regular affair. Over the past couple of months, industrial strikes and picketing has hit nearly all sectors of the British economy. Nurses, teachers, university staff, train and bus drivers, civil servants, security guards, they have all taken part in strikes. Their demands are basically the same: better wages. Inflation is slowing, albeit at a snail's pace, so workers need immediate increments in pay to adjust to the new reality of life in the UK, one where they need more money to survive. But the UK's economy is shrinking. In fact, it will be the worst performing G7 economy this year. so London does not have the fiscal legroom to hike wages. And yet, the workers remain adamant. It'll be interesting to see how Prime Minister Rishi Sunak navigates through this crisis.